Lymphatic taping for the knee. Some of the reasons why lymphatic taping for the knee would be useful are injuries such as ligament sprains, acute muscle or tendon strains around the knee area, tears to the meniscus, and also post-op for knee surgeries such as knee replacements. When we're taping for the knee, for lymphatic taping, we want to aim the anchors towards the lymph nodes. So you're looking at the popliteal lymph nodes, or if you need to anchor higher up, you're aiming towards the inguinal lymph nodes. Lymphatic taping is best served during the acute and early subacute phase when there is bruising, swelling, and edema clearly visible. Key points to consider when using lymphatic taping for the knee. Always anchor towards the popliteal or inguinal lymph nodes, depending on where the area of injury is around the knee. You want to cover the whole area of the edema bruising with the taping, so the fan cut taping works really well to cover that larger area to help that recoil towards the lymph nodes. So here we go for lymphatic taping for the knee. So once you've cut your tape into the 4 strands, you take the back of the tape off at the anchor, so the widest part, and place that towards the back of the knee, towards the popliteal lymph nodes. And then taking the back off each individual strand with a very light stretch of the tissue, creating those individual lines of the tape as equal distance apart as you can. And then once you've applied them all, give the tape a rub to make sure it's stuck down. And then we could do the same thing on the other side. So creating that same crisscross fashion as the other areas such as the ankle and the chest. So we take the back of the tape off at the anchor, place that towards the back of the knee on relaxed tissue, and then take the back of each individual part of the tape into those long strands and gently peeling them away with a light resistance on the tape. Again, trying to aim for an equal distance apart between each of the strands and making that crisscross effect of the tape. And then gently rub all of the strands to stick the tape down.